An adjustment to guidelines covering how iron deficiency is measured in Ontario lab results will be a game changer for patients across the province, according to doctors who worked to make it happen. A memo sent to physicians last week from Ontario Health said that starting September 9th, the best practice guidelines stating the baseline of what has been considered a normal amount of iron will be raised. According to experts, the change means that people who may have previously been told their iron levels are normal despite not feeling well can now be diagnosed with iron deficiency. I'm now joined by Dr. Abhishek Rout, Medical Director at Apple Tree Medical Group. Dr. Rout, thank you for joining us.
Great to be here.
Now, what are some signs or symptoms that someone may be iron deficient?
Now, iron deficiency, we can see it manifest in a lot of different ways. The most common one we see is fatigue and weakness. So, this persistent feeling of being tired. We'll usually see a paler skin as well, especially around the face, the inner eyelids. We also see a lot of shortness of breath, difficulty breathing, especially during physical activity. Some people will also show signs of poor circulation. So, cold hands and feet can be very common. Headaches because of the low oxygen levels reaching the brain. Sometimes, when you're more severe with iron deficiency, you can have palpitations and even brittle nails and hair loss as well.
Now, with Ontario Health changing the baseline of normal iron levels, do you think health officials will follow suit with other deficiencies and change their baseline for diagnosis?
I think that's an interesting question. We're going to see that as we have improved diagnostic accuracy and more of an enhanced public health, we should see some of these other deficiencies taking light as well. For instance, vitamin D, prevalence of a deficiency in Canada is about 64%. We would also see a little bit in the B vitamin. So, vitamin B12, 10 to 35% of the general population is deficient now, not to mention B2 and B6, which have very similar results. And also magnesium, zinc, and vitamin A. So I would expect that over time we are going to see other of these deficiencies changing their baselines.
Now, you've mentioned the symptoms, but how important is it to catch an iron deficiency early? And how much of a benefit will this new baseline have on people's health?
Yeah, so we have to keep in mind for iron deficiency, for instance, it's a significant health concern in Canada. About 30% of women aged 19 to 50 are iron deficient, and roughly the same for teenage girls aged 14 to 18. If we look at all children, roughly 10% of all children are iron deficient as well. So, why do we care? We care because it prevents severe anemia when we target iron deficiency. It protects brain development in children. So, iron deficiency can have irreversible effects on brain development in children. So, we have to catch those early. It makes a huge improvement with quality of life. So, addressing iron deficiencies can alleviate a lot of the symptoms we mentioned. So, the fatigue, the dizziness, the shortness of breath. And ultimately, why governments would look at this as well is it does reduce healthcare costs. We have an early intervention program that can be very helpful in decreasing those costs later on.
Now, I do want to follow up on that. You did just mention that women and teenage girls are more common to have iron deficiencies. Why is that opposed to men having iron deficiencies?
Right. So the most common reason that we see it for women is because women would lose blood regularly through menstruation, which can lead to a significant loss of iron over many months, many years, many decades as well. We also see that during pregnancy, a woman's iron requirements will increase substantially to support the growing fetus and placenta. And so that's a heightened need of iron as well. Certainly, we see with breastfeeding, post pregnancy, breastfeeding women will also have iron needs that are higher than the average. And then finally, we do see some dietary intake differences. Women tend to generally not take a lot of iron rich foods compared to men, which can also cause a lot of issues with deficiency.
And what are things iron deficient people can do to help increase their iron levels?
I think there's a lot that we look at in primary care. The most important is to really consume iron rich foods. So, heme iron sources found in animal products can be very easily absorbed by the body. So, red meat, poultry, and fish are quite helpful. But there are non heme iron sources as well, such as lentils, beans, tofu, spinach, and fortified cereals. What we do recommend is you pair whatever food you have with vitamin C because it just tends to enhance the absorption of it. And if you can't get enough from food in itself, what I would recommend is iron supplements. So, talking to your healthcare provider on the different iron supplements that are out there with minimal side effects that can be used as well.
Dr. Rout, thank you so much for the time.
Thanks so much for having me.